Hey guys, happy Friday. I hope you're having a great week. Welcome back to the Q&A Friday with Dr. Dre, where I answer your skincare related questions as they come throughout the week on my vlog. If you're new here, welcome. I encourage you to give this video a thumbs up and subscribe. I post day in the life of a dermatologist vlogs that include skincare related insights along the way, and fun lifestyle videos, and skincare tips videos. So with that, let's get started. So kind of the first theme of questions that I'm going to address in one statement that pertains to all of them is in this realm of anti-aging, okay? Specifically with regards to products that claim to reverse the signs of aging, like vitamin C serums, topical antioxidants, proteins, peptides, nutraceuticals, vitamins applied to the skin, massaging the skin in a cardinal direction by which you can turn yourself into a baby. I don't know. All of these fall under the umbrella of marketing tactics, okay? Popular culture treats signs of aging as undesirable, continuing to drive a multi-billion-dollar industry aimed at forestalling or even reversing aging. Continuing to drive this concept that somehow age and getting older is undesirable and unwanted. And unfortunately, advancements in science of skin are exploited by marketing industries to sell you things for which there is no substantial data for. The cosmeceutical industry seeks to increase demand for these non-drug products by using language such as clinically tested and dermatologist proven. These tactics entice you to believe that there is valid medical evidence to support cosmeceutical efficacy. While drugs are subjected to a review and approval process, cosmetics are unregulated. There is limited published data to support an anti-aging claim. Furthermore, there is no FDA scrutiny of the evidence from which these claims are made. There is no reliable, rigorous, or peer-reviewed data to support the use of any of these ingredients in anti-aging. And so your money is far, far better spent enjoying your life in the wisdom that you've attained. All right, so the second kind of global set of questions that I've been getting a fair bit about is with regards to acne. So I've been getting a lot of questions about, I have acne and it is causing scars. What should I do? And my number one recommendation to you is to see a dermatologist or a healthcare provider, because acne is a disease that requires evaluation and management by a certified health professional, not the internet. Not all acne is created equal. For example, hormonal acne is not going to be addressed by a Google search and some creams that you can buy at the drugstore. Acne, that scarring, is evidence that the acne is poorly controlled and will likely continue to further scar you. So, sometimes systemic medications are needed. There are a variety of treatments that may or may not be needed depending on your acne. Furthermore, you may think you have acne, but there are a lot of other skin conditions that look an awful lot like acne and are not acne, and therefore things sold in the store for acne are going to be useless to you. So that is step number one. If you have acne, please get in to see a licensed practicing healthcare provider. Yes, dermatologists have the most training and experience managing acne, but the reality of it is many primary care providers and pediatricians do an excellent job. So that should be your start, and that should be your starting point for sure. And but I will say this, definitely never, do not squeeze a pimple. Just don't do it, okay? Just leave it alone. No good can come from squeezing your face. I'll say it again. No good can come from squeezing your face. Okay? Let it shine. Just let it sit there. The more you touch it, the more aggravated it can become. The more likely it is to scar, the more likely you are to get acne elsewhere. So just leave it alone. Or, God forbid, using one of those comedone extractors that they sell over the counter, DIY extractions, gone awry, that please don't do it. We do use that. It's a procedure that we perform in dermatology on select lesions of acne after careful consideration. And then the next kind of global set of questions that I've been getting is if I can address the difference between physical sunscreens and chemical sunscreens. Absolutely. Physical sunscreens contain the ingredients zinc and or titanium dioxide. They physically block ultraviolet light. They're safe and have been shown, when used consistently, to lower your chances of developing skin cancers. While also effective, chemical sunscreens function somewhat differently in that they absorb ultraviolet radiation and that they absorb ultraviolet radiation. Chemical sunscreens need to form a film to be effective, and therefore it is recommended that if you're using a chemical sunscreen that you wait approximately 15 to 20 minutes before going outdoors. However, many sunscreens contain a combination of both zinc, titanium, and or a variety of chemical sunscreen ingredients. These are fine too, but be aware that you need to wait the 20 minutes to allow the film to form. So how do you know the difference between a physical only, a chemical only, or a mambo combo? And the best way to tell is to flip the label over and look at the active ingredients. Or if the active ingredients listed are only zinc and or titanium dioxide, that is solely a physical sunscreen and is good to go on your skin immediately. If you flip the label over and you see ingredients like avobenzone, octoctinolate, things that are a little bit complicated to pronounce, well, those are chemical sunscreen ingredients. And if you see those alongside zinc or titanium dioxide, know that you have a mambo combo going for you. People can become sensitized to some of the ingredients in many of the chemical sunscreens. They can be irritating to you. They can become irritating to you. Many people report that they have a stinging sensation on their skin or around their eyes, and they do not like chemical sunscreens. If that's you, then look for solely zinc or titanium dioxide based sunscreens. The other thing about chemical sunscreens is that they lose their efficacy with time, meaning you need to replace your bottle approximately every 3 years at least, but I chuck mine after a year just because that's the nature of my personality, and I tend to use them up quite quickly. I got a great question about do I need to wear sunscreen while I'm at the gym? The answer is yes. Most likely your gym has windows that do not block out all wavelengths of sunlight. Additionally, you likely don't go in, maybe you do depending on where you live, but you likely are outdoors for a period of time in order to physically enter the gym. So you do need to be wearing sunscreen. And this individual asked this question alongside many others who verbalized concerns that their sunscreens are breaking them out. Sunscreens really should not break you out. And in fact, excessive sun exposure and lack of sun protection certainly worsens the appearance of acne, because sun suppresses the immune system and contributes to the inflammatory component underlying acne. And so I'll be sure and link some sunscreens that I like down below. Be sure you check the description box of this video for some recommendations. I've been showing on the vlogs how I take 10,000 micrograms of biotin daily. And I made a video about biotin and why I love biotin in my kind of everyday routine, which I'll link down below. You guys should check it out. Individuals with brittle nails taking biotin supplements have improvement in brittle nails. We also observed that some hair concerns improved. Biotin is very, very safe. It's a water-soluble vitamin. That's why I take it with food. And many of you have asked and verbalized concern that biotin breaks you out. I myself have never observed that personally or in any of the patients who I follow that take biotin supplements. You know, biotin is a B vitamin, and there have been some reports of vitamin B12 supplements worsening acne. So I suppose it's possible. So if this is happening in you, please go to your dermatologist, and hopefully they'll report it so we can all be on the same page here. Okay? But yeah, the next question that I got with regards to hair is a great question. The individual says, the first part of the question is so important. She says, I saw my medical provider already, and they did a complete blood workup and a complete evaluation and found there was no underlying medical cause for my hair concern. Excellent. That is step number one. And now she wants some just general tips for thinning hair. And I will tell you this, biotin, it can be helpful. I don't know how or why, it just can be. I will also say that it is actually normal to lose 100 hairs a day. Oftentimes what is perceived as hair loss, a major contributing factor is actually hair breakage. So here are some tips on how to minimize hair breakage. Avoid wearing your hair pulled back tight in tight braids or a tight bun, as this chronically pulls on the hair, breaks the hair, and actually can scar the hair follicle down so that the hair does not regrow. It's a contributing factor to thinning in the temples sometimes in women. I call it ballerina alopecia from the bun. Avoiding heat styling, as excessive heat applied to the hair shaft damages the cuticle, and a damaged brittle cuticle is susceptible to breakage. Reconsider some of your hair care practices. I realize it's hard to break up with those things. Avoid brushing your hair when it's wet, as this also can break the hair shaft. Avoid excessively teasing the hair shaft with a brush. Just gentle combing. I myself don't even use a hairbrush or a comb, period, but I have very, very straight, manageable hair, so I totally realize that may not be an option for many, many people. The next question that I get a fair amount about is what are my thoughts on toners? I don't see the point of toners. I suppose if you have excessively oily skin and you're bothered by the excessive oil, then a toner perhaps could be helpful, but toners tend to be incredibly harsh and just dry out your skin. And I've said this on here before, the more crap you put on your face, the worse off things tend to be for you. So I don't see the point of toners, and many three-step systems include them, and I think they're useless. So yeah. Helena Ella asks a great question. Hi, what do you think about using crushed up aspirin pills as like a drying mask for acne? I would not actually recommend that. That sounds very irritating, but crushed up aspirin is basically salicylic acid, so why not just use salicylic acid? And if you're curious about salicylic acid, I'll link some salicylic acid creams and gels down below that'll probably be a little bit easier to tolerate than a crushed up aspirin pill. I think it's fantastic that you all are taking ownership of your health and tuning in and asking, really excellent questions. I really wanted to thank you guys for that. All right, so that's going to conclude the Q&A for this week. I hope you all enjoyed it. Give this video a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys in my next Q&A. Bye.